Hello there, my name is Matthew Kershaw and I'm the Chief Executive of Croydon Health Services and what they call the Place-Based Leader for Health here in Croydon. Croydon is a big London borough, in fact the second biggest borough in London, with nearly 400,000 people who live here. And my job is to look after the health of the population and help run the services for the people that we look after. I'm also the father of 3 daughters, all of who go to Ashford School, and I'm here today to talk to you a little bit about what life's been like in the NHS during the coronavirus pandemic. So Croydon has been hit really hard by coronavirus, and since the start of the pandemic, our first patient in the hospital was the 11th of March. Since then, we've treated in the hospital 1,200 people with coronavirus, and of those, 900, just over, have been successfully treated and discharged, and they've gone home, and that's fantastic for the population themselves, the patients, but also the staff. Sadly, we've also seen 300 people die of coronavirus, and obviously it's tragic for each single one of those people and their family and friends, and that's something that we think about a lot here in Croydon. So to manage the pandemic and to respond to the demands that coronavirus brought on the whole system here in Croydon, we've done lots of different things. So normally we'd see 7,000 outpatients a week. That's people coming in to see doctors, nurses for their medical conditions for an outpatient appointment. In the pandemic, we've done 80% of those appointments by the telephone or by video call. So only a very small number of people have actually been coming to the hospital unless they've absolutely needed to come. And that's a big change to how we work. We've also had people who've been working not on the front line, coming in and working directly with staff who provide care to patients. So they may have been working as a admin assistant one day, and then they'd be working on the wards supporting clinical staff providing care to patients. That's a big change and a major development in the way that we were responding to the pandemic. We've also made sure that our staff have had support. We've purchased and provided over 1 million individual pieces of personal protective equipment, PPE. And we've done that to make sure that our staff are safe and protected, because then they can do the best job for our patients. So lots of changes in how we work. We, at the height of the pandemic, had more than half of the beds here in the hospital, so nearly 300 patients in the hospital with coronavirus. We've worked really hard and really well, and now at the end of June we have just 5 patients in the hospital with coronavirus and nobody in our intensive care department, which is where the most sick patients are at any time in a hospital. So the recovery from the pandemic is a really important next stage of what we're trying to do. First of all, actually, we need to reflect on those things that have worked and those things that we could have done better, and we're doing that all the time. Then we need to think about how we use that information to then restart our services. So that's restarting services which we stopped because we had to put all of our efforts into managing emergency patients. So that's bringing back people who are having planned care for a hernia, for a hip operation, or for an x-ray, for example. So that's all that we're doing at the moment. We also need to prepare for the potential or the probable second wave. And if that comes, our job is going to be to respond to that quickly. And that means making sure that we have a good plan in place, but also that we have good information for people so that patients know, so that staff know what to do, when to do it, and how to do it. And to help with that, we've printed huge amounts of signage and other information. It amounts to about 11 football pitches worth of material, which we're now using to direct people around the hospital, to provide them information, and that's another big part of what we're going to be doing in this next phase of responding to the pandemic. Coronavirus is going to be something we're going to be living with for a long time. Until we have a vaccine, then new people are going to be infected, and so we've got to remain vigilant for any second wave that comes. We've also got to look after the patients who have recovered from coronavirus. If you've had coronavirus and you've been discharged from hospital, or you stayed at home and you're now recovering, it's not something that you can get better from in hours and days. It's weeks, and in some cases months, to get fully fit after coronavirus. And part of my job is to look after people not just in the hospital, but in our community as well. So our district nurses and other teams are out there now supporting patients who have been through coronavirus and now need a lot of support and therapy and assistance so they can get as fit as they possibly can and get back to their normal way of life. I think there's been lots of things that are difficult, of course, but there's thing that stands out to me is about the impact that it has on people that you care about, whether that's a patient, whether it's a member of the public, or for me, a lot of the time, it's about some of my staff. So there's a member of staff who I saw today, who I've known the whole time I've worked here in Croydon. She's worked here for over 25 years. She's a ward sister on an elderly care ward, and she's a fantastic person. She's a great example of what the best about the health service. She cares for people, she's hardworking, she's got a glint in her eye, she can be a bit cheeky sometimes, and I really like that, and that's who she is. And she got coronavirus, and she had it quite bad. She was quite sick for quite a long time, and she's been off work now for a couple of months, and she's back last week, and I managed to get to see her today, and it was fantastic to see her because I haven't seen her for a while, and she always makes me smile. But you could see she's trying to get back. She's still not 100%. She's free of coronavirus, but she's tired and she needs a lot of support physically to help her do her job. But also we need to look after her because she's got quite worried that, she wouldn't be able to get back to work, or that she's not going to be able to manage now she is back at work. And so the mental health support that we need to provide all of our staff, particularly those who've been directly affected, is going to be something that is really, really important. And that's one of the things that I've learned myself through this period. I've worked in Croydon now for nearly 2 years, and I really love my job, and I think it's a really important job, and I enjoy doing it. The pandemic has been a really challenging time. It's been hard work, and the staff have worked tirelessly in sometimes extremely difficult circumstances. But what's made me most proud is seeing them work together, pulling together, working as a team, looking after each other and looking after our patients so that we can respond well to something that none of us have been through before. And to see that in action every day has been fantastic and something that I'll never forget. And it's, as I say, made me feel very proud and positive about what everybody's done. And I know that's happened up and down the country, and the Clap for Carers that's happened on a Thursday actually made me quite emotional when I saw it the first time, because I could think about people who work for me going the extra mile day in, day out to look after the people who we're responsible for, and that has been something that I think has been amazing and, as I say, made me very proud and very positive about everything that we've done here in Croydon.